Hello everybody. Today I'll talk about the major veins in the body. Arteries take the blood away from the heart and veins bring the blood towards the heart. So this is the heart and the main differences between the arteries and veins are: number one, arteries take the blood away from the heart. So large arteries give branches to the smaller arteries. Okay, so this is a large artery, this one, and blood from the large arteries enter into the smaller arteries, and then from the smaller arteries blood go to further small arteries. So the arteries take the blood away from the heart. Okay, and that's why these smaller arteries are called the branches of the large arteries. In case of vein, it is opposite. Smaller veins give blood to the larger veins, okay, and then larger vein brings the blood towards the heart, okay. So large veins receive blood from the smaller veins and then give the blood to further larger veins, and finally two largest veins, superior and inferior vena cava, they give the blood to the heart. So blood moves towards the heart, okay, and these smaller veins that give blood to the larger veins, these smaller veins are called tributaries. Tributary. Okay, so instead of branches we say tributaries. It's like we know that small rivers give the blood to the large rivers. Okay, now we'll see the veins in different locations in your body. First, in this picture you can see the major veins in the body. So let me give you an overview of the entire body first. So as I told you, two large veins bring the blood into the heart. So superior vena cava and inferior vena cava. Superior and inferior vena cava, these are two veins finally bring the blood into the heart, and right atrium of the heart receives the deoxygenated blood from the superior and inferior vena cava. Okay, superior vena cava brings the blood from the upper part of your body, like from your head part, neck part, and upper extremities. Inferior vena cava brings the blood into the heart from the lower part of the body, from the lower part of the trunk and lower extremities. Now let's see superior vena cava. For convenience, we will go from the large vein to the small. Okay, although I already mentioned that in case of venous system, the small veins give blood to the larger veins, and larger veins bring the blood towards the heart. Okay, so this is superior vena cava. Superior vena cava divides into two brachiocephalic veins. Okay, here you can see this is the left brachiocephalic vein, and here is the right brachiocephalic vein. So two brachiocephalic veins. Then the brachiocephalic veins divide into two. So let's see here, right and left brachiocephalic veins. Then both divide into internal jugular vein, which moves towards the head. Okay, so you see here, this is the internal jugular vein, and subclavian vein. So subclavian, its name is telling you it goes under the clavicle. You see here, this is the clavicle. So subclavian is under the clavicle here. Okay, this side, left side here. Okay, so this is the subclavian vein. So internal jugular goes towards the head, towards the brain, and subclavian under the clavicle. Okay, and then subclavian goes to the armpit and becomes the axillary vein. Okay, like the arterial system, armpit, axillary. Okay, so this is the axillary vein, and from the upper part of the axillary vein, two large superficial veins arise. What are those? Lateral one is called the cephalic vein, and medial one here, this is called the basilic vein. So you can see here, this is the cephalic vein here, and this is the basilic vein. Okay, now subclavian, before it becomes axillary, this is an important vein that gives blood to the subclavian. This one is called the vertebral vein. Here you can see in this side, this one is the vertebral vein. It gives blood to the subclavian vein. It also brings blood from the brain. Okay, so internal jugular and vertebral, they mainly bring the blood, deoxygenated blood from the brain. And okay, so cephalic and basilic are two superficial veins of your upper limb. However, the axillary continues and becomes the brachial vein, like the arterial system. Okay, and brachial vein is a deep vein in the deeper tissue. I mentioned cephalic and basilic, these are superficial. Okay, so in your arm you have three large veins, two are superficial and one is deep, these three. Okay, then what happens in the front of your elbow here in this area, cephalic and basilic are connected by a short vein that is called the median cubital vein. So this one here, this is the median cubital vein. This side you see here, this is the median cubital vein. It connects the cephalic and basilic, and in most of the cases we collect the blood from this median cubital vein for the laboratory test. Okay, then what happens, the brachial vein, which is the deeper vein, goes to the forearm and divides into radial and ulnar veins. Lateral side, radial side is the radial vein, and ulnar side is the ulnar vein. And from the lower part of the radial vein, you know that we take the pulse, heart rate. Often we use the lower part of the radial vein here just above the wrist to take the heart rate or pulse. The reason is, under the radial vein in this part there is no soft tissue, it directly lies on the bone. So when you press with your finger, it cannot move down, so you can easily get the pulse. Okay, so radial and ulnar are the branches of the brachiocephalic vein, or tributaries of the brachiocephalic vein. Then cephalic and basilic, they go to the forearm from the arm, and from the basilic vein tributary arises, and that is called the median antibrachial vein. Okay, median antibrachial vein. Let me see if they have shown it here. Probably not. So this one here, you see a branch arises from the basilic, and this is the median antibrachial. I'll show you later. So just know that those are the veins in the forearm, radial and ulnar, as well as cephalic, basilic, and the median antibrachial vein. Then in the palm, the radial and ulnar, they divide and form, join together those two pairs to form two arches, the superficial and deep palmar arches. And then the branches from the palmar arch enter into the fingers, and those are the digital veins. Okay, digits into the fingers. So that is the upper part. Now let's see what happens uh, to the internal jugular. So here you see the internal jugular, right? I told you that it is going towards the head. So a tributary of the internal jugular is mandibular vein. It goes under the mandible, and from there we get the fascial vein here. So this is the fascial vein. So from the internal jugular we get the mandibular vein, and from the mandibular we get the fascial vein, goes to the face. And also we get another branch from the mandibular that goes to the temporal part of the head. You see these veins called superficial temporal veins. Okay, so you can write it down: superficial temporal veins, these veins, and fascial veins here in the face. You know, this is the temporal part of the head, so superficial temporal. Okay, and the internal jugular enters into the cranial cavity and gets blood from the brain. Okay, now let's see the inferior vena cava. Inferior vena cava gives blood also to the right atrium. Inferior vena cava pierces the diaphragm like the aorta and runs side by side of the aorta. And inferior vena cava gives a number of tributaries, or receives blood from a number of tributaries from the liver. Hepatic veins, okay, bring the blood into the inferior vena cava. From the diaphragm, the phrenic vein brings the blood into the inferior vena cava. From the kidneys, renal veins bring the blood into the inferior vena cava. From the suprarenal glands or adrenal glands, also the tributaries bring the blood into the inferior vena cava. As well as, you remember I said that the mesenteric indicates the intestine, so mesenteric veins bring the blood from the intestine. Okay, and here you see the lower end of the inferior vena cava. Okay, it divides into two common iliac veins, and then common iliac divides into two, receives blood from two. The bigger one brings blood from the lower extremity or lower limb, that is the external iliac here, and the smaller one brings blood, deoxygenated blood from the pelvic organs into the common iliac, and that is the internal iliac. Okay, so larger one is external iliac and the smaller one is the internal iliac. larger one, external iliac, receives blood from the leg, and internal iliac receives blood from the pelvic organs, and then they give the blood to the common iliac. Okay, so those are two tributaries of the common iliac, the external iliac and internal iliac, like the arterial system. And then the external iliac goes to the thigh and becomes femoral vein. However, from the very upper part of the femoral vein, the longest vein of the body arises. That is called the great saphenous vein. You see here, great saphenous vein is the longest vein of the body because it starts from the very upper part of the thigh, right, and goes all the way to the foot. So this is a very long distance and it is a superficial vein. Now let's see the femoral vein. This is the femoral vein, this one. Okay, and from the upper part of the femoral vein you got the great saphenous vein, as well as another large vein arises, and that is called, the tributary is called the circumflex vein, circumflex femoral vein, this one. Okay, so now the femoral vein goes to the knee, and behind the knee its name becomes popliteal vein because that area is called the popliteal area. And from the popliteal vein we get the small saphenous vein, another superficial vein, small saphenous vein arises from the popliteal. You see here, this is the small saphenous, and anterior tibial, posterior tibial. The popliteal divides into anterior and posterior tibial, and from the posterior tibial we get the fibular vein. So in your leg you have a number of veins, right? You have the small saphenous, you have the anterior posterior tibial, you have the fibular vein, as well as the great saphenous. You see, the great saphenous also goes all the way down to the foot, I told you. So great saphenous, lower part of great saphenous is also in the leg. Okay, we have the venous arch. Okay, dorsal and plantar venous arches. And from the venous arches we get the metatarsal veins and the digital veins. So that is the intravenous circulation in your body, and the large veins. There are many smaller veins, those we cannot cover in this lecture. Now I already explained this, but you can see in a larger picture, so it will be easier for you. This is one side, right side of the body. So you know that superior vena cava brings the blood into the right atrium, right atrium. And I also told you superior vena cava has two large tributaries, right and left, brachiocephalic vein. So this is the left brachiocephalic vein, and this is the right brachiocephalic vein. Okay, they give blood to the superior vena cava. Make sense? Then I told you that the brachiocephalic vein receives blood from two large veins. One goes towards the head or brings blood from the head part. This is called the internal jugular. So this is right internal jugular. Makes sense? And this is also going to from the left internal jugular, left internal jugular from the head part, and this is the subclavian. This is the subclavian. Okay, so these two are subclavians. So brachiocephalic receives blood from the internal jugular and subclavian of the respective side. So this is subclavian vein. Okay, subclavian goes under the clavicle and becomes what? Axillary, right? Goes to the armpit. So this is the axillary vein, and then from the axillary vein we get two large superficial veins. Remember that? One is called the cephalic, another is called the basilic. Make sense? So these are two large superficial veins of your arm. This is the cephalic vein and this is the basilic vein. Okay, and axillary continues as a deep vein and it becomes what? The brachial vein in the arm. Okay, so this part is like your arterial system. So this is the brachial. Make sense? And then brachial divides into two, radial and what? The ulnar. Okay, so this is the lateral side. So this is radial vein. This is the ulnar vein. Okay, and what happens to cephalic and basilic? In front of your elbow, they get connected by a vein that is called the median cubital vein. We collect the blood for lab. So median cubital vein. Okay, and then the cephalic and basilic, they go down to the forearm, and from the basilic I said that the median anti-brachial vein is formed, and then go to the hand, and in the palm two arches, uh, superficial and deep palmar arches, and from those arches we get the digital veins for the fingers. Okay, so that is the upper limb. Now let's talk about this picture. You remember, this is the right internal jugular, this is the left internal jugular. Okay, what happens? The internal jugular gives a branch that goes under the mandible, or internal jugular has a tributary under the mandible, and this is the mandibular vein. Makes sense? The name, right? Mandibular vein. And from the mandibular we get a vein that is going to the scalp of the head, in the side of the head. So that is the superficial temporal, gives branches. So superficial temporal, in the temporal part, right, of the head, side of the head, and another to the face. So this is the facial vein. Okay. So from facial and superficial temporal, blood goes to the mandibular vein, and from there to the internal jugular. Now what happens to internal jugular itself? It enters into the cranial cavity and receives blood, deoxygenated blood from the brain, internal part of the head, mainly from the brain. Okay, so that is how the venous system in the upper part of the body. Here I mentioned another important vein, gives blood to the subclavian vein. This is called the vertebral vein, and it brings deoxygenated blood from the brain too. So this is vertebral vein. Okay. So now let's see this picture, it will make it easier. So this is superior vena cava, right? It divides into two brachiocephalic, and this is the right side, so you can only see the right brachiocephalic vein. Okay, and the right brachiocephalic, then you see, receives blood from the right internal jugular, this one, and subclavian, this big one. Subclavian goes under the clavicle. This is clavicle, they have dissected it. So subclavian, and this is the internal jugular. Now you see here, from the internal jugular, this is the mandibular vein, this is the facial vein going to the face, this is the superficial temporal vein. Okay, I already explained this here. And now you see the internal jugular is going to the cranial cavity. So you see here through the jugular foramen, and actually it receives blood from the internal part of the head. And now here let's see the vertebral. This is the vertebral vein here. Vertebral vein. You see it also brings the blood from the inner part of the head, mainly from the brain. Okay. And another branch that also arises or brings blood into the subclavian vein is the external jugular vein. External jugular, which is smaller than the internal jugular. So external jugular, external, the term, that means it mostly brings the blood from the outer part of your head. So you see that external jugular receives blood from the occipital vein, from the back part of the body. Okay, so occipital vein gives blood to the external jugular vein. Okay, and we already talked about that. From the superficial temporal, from the facial, blood eventually goes to the internal jugular vein. Okay, so here you see three veins: external jugular, vertebral, internal jugular. Okay, here I already explained this too. Subclavian, you see under the clavicle here. So this is the right side, right subclavian vein, and it becomes axillary vein in the armpit area. Okay, and you see from the axillary, this one is the cephalic vein, the lateral one, and this one is the basilic vein. Two superficial large veins, right? And then the axillary becomes brachial vein, which is the deeper vein. That's why you see the color is like less dark. And then let's follow the brachial first. It is like the artery. It divides into radial and ulnar in the forearm. Okay, so radial vein and ulnar vein. Okay, and you see here median cubital vein connects the cephalic and basilic, those two superficial veins. Okay, now you see cephalic and basilic, they enter into the forearm. However, from the basilic, this another vein arises, and that is called what? The median antibrachial vein, that I could not show you before, but I mentioned the name few times. Okay, so in the forearm you have a number of veins, right? Large veins, the cephalic, this one, basilic, median antibrachial, as well as radial and ulnar. Okay, and in your hand you have superficial and deep palmar arches, venous arches, and from the venous arch we get the digital veins. Now here in the thoracic part, you see here um, you have a couple of very important veins. I'll mention those. This vein is called the Azygos vein. This one, Azygos vein, you see, connects the superior and inferior vena cava. So superior vena cava is here, and this is inferior vena cava, and the Azygos vein actually brings the blood from the inferior vena cava to the superior vena cava. So it's an alternate route of blood. If any blockage occurs, then blood will be continue to flow between these two large veins. Now, azygos vein, azygos, the word means unpaired, so we have only one azygos, and it is located in the right side, along the right side of the vertebral column. You see, this is the vertebral column, right? Your spine. So azygos is in the right side, and the azygos vein mainly receives blood from the posterior intercostal veins. You see, these are the intercostal veins in between the ribs in your thoracic part of the body. So from the right intercostal veins, the blood is given to the azygos vein. Okay, so these are the right intercostal veins, right posterior intercostal veins in the back, in between the ribs. Now, that is the azygos vein. There are two more veins in the left side of your vertebral column here, in the left side, called Hemiazzegas, although you can see here only they have shown by one, but this one actually, let me draw here. So this is your vertebral column. Okay, so this is the vertebral column. These are vertebrae in the thoracic part, and here you have the diaphragm that separates the thoracic and lumbar. So this is the vertebral column. It continues. Okay, go to the lower part of the back of the body. Anyway, so this is the vertebral column, and your azygos vein is where? In the right side of the vertebral column, and it passes through the diaphragm too, little bit, small part of it goes to the abdomen. Okay, so this is the azygos vein, and it receives blood from the intercostal posterior right intercostal veins. Okay, right posterior intercostal, okay, veins. And in this side, in the left side, as I told you, there are two hemiazzegas. One is, this is the second posterior intercostal, third, fourth, fifth, and not the first one, because first one gives blood to the subclavian vein directly. Okay, so these are also posterior intercostal, left posterior intercostals, posterior intercostal veins. Okay, as well as there is another vein that is called subcostal. So these are also left posterior intercostals, but lower left posterior intercostals. Okay, so there are two hemiazzegas and one azygos. Azygos is in the right side of the vertebral column, and hemiazzegas are in the left side of the vertebral column, and they receive blood from the intercostal veins. Okay. The superior hemiazygos is also more commonly known as the accessory hemiazygos vein. So accessory hemiazygos vein is the upper one, and okay, so those are the veins in the thoracic part. So in this slide you have seen the veins of the upper limb and the thoracic part of the body. Now we'll see the major veins in the abdominal part. So this is the inferior vena cava, the largest vein in the abdominal part. Inferior vena cava receives deoxygenated blood from the abdominal organs. Okay, so from the liver, hepatic veins bring the blood into the inferior vena cava. Okay, from the diaphragm, phrenic vein. The word phrenic indicates diaphragm. Okay, so this is the inferior phrenic, and then you see here renal veins from the kidneys, right and left. Now let's see the suprarenal. You see the right suprarenal from the adrenal gland here gives blood directly to the inferior vena cava. The right suprarenal directly goes to the inferior vena cava. However, the left suprarenal first gives blood to the left renal vein. Then left renal vein takes that blood to the inferior vena cava. So left suprarenal doesn't directly give blood to the inferior vena cava. Instead, it gives blood to the left renal vein. So that is the difference. And also, inferior vena cava receives blood from the other tributaries, as I mentioned. Mesenteric, it is not shown here. Mesenteric from the intestine, then gonadal from the gonads. Okay, so those tributaries or smaller veins bring blood into the inferior vena cava. Then lower end of the inferior vena cava divides into two common iliac, the left common iliac and right common iliac. Then common iliac, since common, it divides into external and internal. So you see this is the external iliac and this is the internal iliac in both sides. Okay, and internal receives deoxygenated blood from the pelvic organs and external receives blood from the lower limb. So now let's see the lower limb. Okay, so this is the external iliac, this is the right side, and external iliac goes to the thigh and becomes the femoral vein. Makes sense, right? And from the very upper part of the femoral vein, I mentioned great saphenous vein, superficial vein, but this is the longest vein because it goes from here to all the way to the foot. So longest vein of the body. Now let's see. You see this is the circumflex femoral. They did not label it. Circumflex femoral. This is femur, right? The bone. So circumflex is going around. You can see here it goes around like this. Okay. Then what happens? The femoral vein in the back of your knee becomes the popliteal vein, and then the lower end of popliteal divides into, you see here, the small saphenous vein in the leg. That is another superficial vein. So you got great saphenous and small saphenous, right? And there are two saphenous, and also we get anterior tibial, posterior tibial, and also from posterior tibial we get the fibular vein. So this is anterior tibial here, posterior tibial is here, and this is the fibular vein here. You can see here goes like this. So this is posterior tibial here. From posterior tibial we get the fibular. Okay, and in the foot you have two venous arches, the dorsal and plantar venous arches, and then metatarsal veins and digital veins. In the back you can see more clearly what I said. So this is the popliteal vein, the back of the knee, and this is the small saphenous vein, this one, right, and this is the popliteal, continues, right, after it gives the small saphenous it continues, and then it divides into anterior tibial and posterior tibial. This is the posterior tibial, this one, and this is the anterior tibial. They have dissected, they did not show it because this is the back, so it goes to the front of the tibia and posterior tibial back of the tibia. That's why you see the posterior tibial here. Then from the posterior tibial you see the small saphenous vein arises. Okay, and posterior tibial goes to the sole of the foot, the plantar surface of the foot, and it divides into two plantar veins. You know the sole of the foot is the plantar surface, so two plantar veins, and then two plantar veins join to form the deep plantar arch. Okay, and from the deep plantar arch we get the digital veins. Okay, so digital veins are the tributaries of deep plantar arch. Okay, now I'll talk about circulatory system in your body, that is called the hepatic portal circulation. Hepatic means liver, and portal circulation means where the blood vessel connects two sets of capillaries. Okay, so here you have one set of capillaries, here you have another set of capillaries, also another set of capillaries. Okay, and in few places we have this system that two capillaries or two sets of capillaries are connected by a blood vessel, that is called the portal vessel or portal system. Okay, and this portal system is called hepatic portal system or circulation. Why? Because it connects the capillaries of your intestine, GI tract, gastrointestinal tract. So these are the capillaries in your gastrointestinal tract, wall of the GI tract, and these are the capillaries in the liver. Okay, so the hepatic portal vein, which is also called portal vein, brings the nutrient rich blood from the GI tract, because you know that blood receives nutrients from the GI tract, and that nutrient rich blood is taken to the liver by this portal circulation. Okay, so let's see here. This is the stomach. So from the stomach, the gastric vein, you see this one gives blood to the portal vein, hepatic portal vein. From the intestine, you already know the mesenteric, remember that. So you see superior mesenteric from this part of the intestine, inferior mesenteric. So two mesenteric bring the blood into the portal vein, hepatic portal vein, and from the intestine, and from the stomach, the gastric vein. So all the blood, nutrient-rich blood from the stomach and intestine is given to the hepatic portal vein. From the stomach, gastric vein; from the intestine, superior and inferior mesenteric veins. And then the portal vein gives blood to the liver. This is the liver. So this is the hepatic portal circulation to transport the nutrients from the GI tract to the liver. Why blood should go to the liver first from the GI tract? Because the nutrients are first processed in the liver. Liver is the organ that first processes the nutrients. Okay, so that is the hepatic portal circulation. Now I'll talk about the capillaries. Just we will see different types of capillaries. Three types of capillaries are the main capillaries in your body, and we'll talk about the capillary bed. We'll talk about the blood pressure and regulation of the blood pressure. Okay, so through the wall of the capillaries, gas and chemicals are exchanged. So gas and chemicals. Chemicals include many types of chemicals, nutrients, metabolic wastes, right? So we know that the capillaries in the tissue, so these are the capillaries. Capillaries form bed in the tissue, and oxygen gets out from the capillaries through the capillary wall, because your tissue or cells need oxygen, right? As well as nutrients also get out. So those two things are given to the tissue. Tissue needs these things, right? Oxygen and nutrients. So they leave the capillary through the capillary wall. However, the tissue produces metabolic wastes. So the metabolic wastes and carbon dioxide, right? So they are toxic. So they go from the tissue to the capillaries, okay, to the blood. And that is the exchange through the wall of the capillary. So capillaries are for the exchange of the gases, oxygen and carbon dioxide, and the other chemicals, nutrients, metabolic wastes. Three types of capillaries are found in the body: continuous capillaries, least permeable, then fenestrated capillaries are more permeable than continuous capillaries. Sinusoidal capillaries are very permeable. Okay, so the larger particles can pass through the wall. Highly porous. So continuous capillaries, why least permeable? Because tight junctions connect the cells. So the endothelial cells in the wall of the continuous capillaries are connected by the tight junctions. Make sense? That's why least permeable. Intercellular clefts. You know, cleft means the gap. You have heard the term cleft lip, cleft palate. So gap. Intercellular clefts are very small, so allow only the passage of fluids and small solids, not larger solids. Okay, where you will find the continuous capillaries, skin, muscles, as well as in the brain. However, the continuous capillaries in the brain is less permeable than the continuous capillaries of your skin and muscles. Okay, so Why is that? Because you know that brain tissue is highly sensitive. So the wall of the continuous capillaries in the brain is least permeable, will not let any toxic chemicals enter into the brain tissue. Okay, so that is called blood brain barrier. So here you see in this diagram, these are the endothelial cells, and in between the endothelial cells in the wall you have the clefts. However, the clefts are very narrow. Intercellular clefts are very narrow. Okay, which makes the wall least permeable, and they are connected also by the tight junctions. Fenestrated capillaries. Where you will find the fenestrated capillaries? In the small intestines, endocrine glands, and kidneys. Fenestrated capillaries have fenestrations and pores. So the clefts are larger than the continuous capillaries, and also there are pores. You do not see pores in the continuous capillaries. So more permeable than continuous capillaries. And just remember that the organs where the absorption, filtration, and secretion occurs. So absorption, filtration, as well as secretion occur. Those three functions through the wall of the fenestrated capillaries. So now we know that absorption of nutrients take place in the small intestine, filtration occurs in the kidneys, right, and secretion from the glands. So the chemicals can get out or get in through the wall of the fenestrated capillaries. Nutrients will get into the capillaries of the small intestine. Hormones will get out from the uh, glands and enter into the capillaries uh, through the wall of the capillary, and toxic chemicals and water gets out in the kidneys. So here you see the picture of a continuous fenestrated capillary. So you see the endothelial cells in the wall, and in between the cells the space is larger. Here you can see larger space between the endothelial cells, as well as you see here through the endothelial cell wall you have tiny pores or holes. So the presence of these pores also make the wall more permeable. So secretion, absorption, and filtration can take place through the wall of the fenestrated capillary. It's like the filter. Sinusoidal capillaries, the most permeable and larger intercellular clefts and larger lumens, and where you will find the sinusoidal capillaries in the liver, bone marrow, and spleen. You already know liver and spleen are the sites where the red blood cells or blood cells are destroyed, right? So they must get out from the blood vessels, from the blood, and enter into the liver and spleen. Then the macrophages will destroy them, right? So you just think that in these two organs, from the capillary, the red blood cells should be able to get out to enter into the liver and spleen. That's why the sinusoidal capillary wall has larger clefts. Otherwise red blood cells or other blood cells will not be able to get out. Okay, and bone marrow, we know that bone marrow is the site where the blood cells are produced. So also in the bone marrow you have the sinusoidal capillaries. So new blood cell from outside of the capillary can enter into the blood. Okay, so old blood cells will get out to the liver and spleen, and new blood cells will get in. So that's why in these organs you have the sinusoidal capillaries. The blood cells and large molecules can pass through the wall. Okay, so here you see the intercellular clefts are very large, and also the pores in the wall are very big. Okay, capillary bed. Uh, Blood capillaries form beds in the tissues, and here you see the arterial, small artery is called the arterial, and from the arterial the capillary originates, okay, arises, and the capillary makes network. The branches of the capillaries make the network, and those networks are called the capillary beds. And so this is one. Here you see capillary bed, and since capillaries give oxygen to the tissue, so oxygen gets out from the capillaries. That's why in this side you see gets blue. That means less oxygen in this side of the capillary, more oxygen in this side. So when blood enters into the capillary bed, it has a lot of oxygen. However, as the blood passes through the capillary bed, oxygen gets out, so blood becomes, and carbon dioxide enters, so blood becomes deoxygenated. Less oxygen, more carbon dioxide. So in the other side of the capillary bed, you have deoxygenated blood in this side, and this side you have oxygenated blood. Okay, and deoxygenated blood then enters into the vein, small vein. Now you see here this one blood vessel that directly connects the arterial and venule. This is called the metarterial. And from the metarterial, the branches arise and form the capillary beds. Now, where from the metarterioles the capillaries come out, you have the sphincters there. These are called pre-capillary sphincters. And you know that sphincters can constrict or relax. So, when more blood should circulate in the capillary bed, the sphincters relax. So more blood enters into the capillary bed. When the sphincters constrict, then less blood or almost no blood enters into the capillary bed. So here you see the sphincters are dilated, sphincters are open, so a lot of blood is flowing in the capillary beds. Here sphincters are closed, so less blood is flowing into the capillary beds. Okay, so that's how the capillary bed is formed, and how the blood flow into the capillary is controlled. Okay, now I'll talk about the differences between an artery and vein. If you see an artery, you'll see that the arterial wall is thick and lumen is small. So thick wall and that's why the lumen is small. Okay, and round too, because the wall is thick, so it is not flat, round. Even when there is no blood inside, it will stay round and open because the wall is thick. Okay, and in case of vein, you'll see the wall is thin, and that's why the lumen is what? Larger. So thin wall, and lumen is what? Larger. Larger lumen. Makes sense? And since the lumen is larger and wall is thin, when the vein is empty, it gets easily flat. Okay, so not always round, so flat, larger, and wall is thin. The pressure inside the artery is high. So inside the artery, the pressure is high. Why? Because you know that first from the heart, blood enters into the arterial system, into the arteries. Then through the capillaries, blood enter into the vein. So you know, as the blood goes far away, the pressure goes down. And after the blood passes through the capillaries, the pressure gets really low. Okay, so inside the vein, the pressure is very low. Okay, and we know that arteries take the blood away from the heart, veins take the blood towards the heart. So those are the differences between the arteries and veins. If I ask you either in the lab or lecture, you should be able to write down those things. Okay, now we'll talk about the blood pressure. The last thing, the blood pressure. You know that blood passes through the artery, and while the blood passes through the artery, pressure is this way, right? However, some pressure also is given to the wall. So this is the main pressure that moves the blood through the arteries. However, while the blood passes through the arteries, pressure falls on the wall, and this pressure is called the lateral pressure. So blood pressure is the lateral pressure given or exerted on the arterial wall. So this is the wall. Okay, so blood pressure is the lateral pressure exerted or given to the wall of the artery while the blood passes through it. Okay, and three factors directly regulate the blood pressure. Three factors regulate the blood pressure directly. What are those? Blood volume, number one. If blood volume is more, blood pressure is more, because inside the blood vessels or artery you have more blood. That means the pressure on the wall will be more. Makes sense? So less blood volume, pressure is what? Less, right? So if the blood volume really goes down, like due to severe hemorrhage or bleeding, or you know other reason, dehydration, then blood pressure will drop, will be very low, and that is called the hypovolemic hypotension. Hypovolemic hypotension. Hypotension means, hypo means less, right? So less blood pressure due to what? Hypovolume, less volume of blood. Okay. Number two is the force of contraction. If the heart contracts more forcefully, more blood will get out, will enter into the vein, arteries, more blood, so that will increase the blood pressure. It's simple. Okay, so increase force of contraction, increase the blood pressure. Okay, and now another one is the peripheral resistance. Peripheral resistance is the wall of the artery. It is not related to the heart. It is related to the wall, condition of the wall of the artery. You know, if the arterial wall is more elastic, elasticity is more, then when the blood will enter into the artery will be able to stress, dilate. Okay, so the pressure on the wall will be less. If the arterial wall loses the elasticity, then the artery will not be able to dilate, will not be able to, get bigger, so will not be able to expand, so the pressure on the wall will be more. So that is the peripheral resistance, and if the peripheral resistance is more, then blood pressure will be more. Okay, so those are three factors. One is blood volume, another is related to the heart, how forcefully the heart contracts. If more forcefully, more blood will enter into the artery, blood pressure will be higher. Peripheral resistance is related to the wall of the artery, the elasticity. If the elasticity is less, the pressure will be more. Okay, if the elasticity is more, pressure will be less. Okay, now there is a way to calculate the blood pressure. Blood pressure equals to, we can say, equals to cardiac output times blood pressure equals to cardiac output times total peripheral resistance. Okay, cardiac output related to the heart, I have already mentioned, right? How much blood gets out during the contraction of the heart, and peripheral resistance related to the arterial wall. So this one is related to the force of contraction of the heart, and this one is related to the elasticity of the arterial wall. Okay, so cardiac output and peripheral resistance. Now cardiac output depends on the force of contraction of the heart. Okay, now there is a clinical condition where the artery, the wall of the artery loses the elasticity. It happens due to a number of factors. Age is one factor. As we get older, the elastic tissue amount decreases in the wall, so the arterial wall loses the elasticity, right? So in that case, the pressure will be high, the peripheral resistance will be high. When the blood enters, arterial wall cannot expand. So that hardening, there are other factors like smoking or some lifestyle, food can also cause that, fat food. So hardening of the wall, and that is called, that clinical condition is called arteriosclerosis. So arteriosclerosis is the hardening of the arterial wall, and that will increase the blood pressure, increase the peripheral resistance, increase the blood pressure. That happens due to age, and also smoking and fat-rich food. Those are the main causes. Now there is another clinical condition in which it happens. This is the wall of the artery. Fat accumulates inside the wall. So when the fat accumulates, the arteries get narrow or closed. Okay, so that is another clinical condition that is called atherosclerosis, slightly different name, right? So hardening due to loss of elasticity, change of the tissue, that is arteriosclerosis, and narrowing of the lumen of the artery due to accumulation of fat or fat plaques, that is called atherosclerosis. Prolonged atherosclerosis can lead to arteriosclerosis. Okay, so that is the blood pressure. Now there are 4 types of blood pressures. 2 we directly measure from the wall of the artery. You already know probably: systolic pressure and diastolic. Systolic pressure is the maximum pressure during the contraction of the heart or ventricle, and diastolic is the minimum pressure during the relaxation of the ventricle or heart. Okay, systole means contraction, diastole means relaxation. Okay, so systolic pressure is the maximum pressure during the contraction of the ventricle, and diastolic pressure is the lowest or minimum pressure during the relaxation of the ventricle. You already know when ventricle contracts, blood enters into the artery, right? So the pressure will be high. When the ventricle relaxes, blood comes back into the heart, so the pressure on the wall of the artery will be less. That's why the systolic pressure is high and diastolic pressure is low. Okay, we measure both, and from these two we measure 2 other pressures. One is called the pulse pressure. This is very simple: systolic minus diastolic. Okay, and mean arterial pressure or MAP, that is diastolic plus 1/3 of pulse. So first we need to measure the pulse, then we have to get the mean arterial pressure, 1/3 of pulse pressure. So if your systolic is 90 and diastolic is 60, the pulse pressure is 30. Make sense? And now MAP will be 60 plus 1/3 of pulse. That means 10, right? So 60 plus 10 is 70. Okay, so that's how we calculate the blood pressures, the pulse and mean arterial pressure.